Hi, my name is Eric, and this is my PDSA project involving improving HCAP scores for discharge planning and transfer of care. So, the issue identified is simply a fact that hospitals consistently fail to meet the national standards in the areas of discharge planning and transfer of care. This is an issue because the Centers for Medicare and Medicaid Services penalizes those hospitals that do not meet the standards, and of course, it provides poor outcomes for the patients themselves. According to the Center for Medicare and Medicaid Services, value-based purchasing is simply a way to reward acute care hospitals for the quality of care they provide rather than the number of services they provide. The benefits include financial reimbursement and a greater reputation. The potential penalty takes the form of financial withholds based on the performance that they get on their HCAP survey scores. HCAPS is simply a national standardized public tool that reports the survey that patients receive regarding their perspective of their hospital care. It has 27 questions related to the quality of stay. The surveys are administered between 48 hours and 6 weeks after their hospitalization, and patients have the choice of selecting the appropriate response to questions which include never, sometimes, usually, always, no, and yes. In order for the scores to reflect favorably on the hospital, they need to choose the top box reply, which is either always, strongly agree, or the yes response. So the public are able to access the HCAP scores that hospitals receive under Medicare.gov. For my clinical site, I found the question about were patients given information about what to do during recovery at home, and 78% said yes, but the national average is 87%. Patients who strongly agree that they understood their care when they left the hospital was only 41%, but the national average standard is 53%. So the hospital that I went to has some work to do on improving their scores. So, what exactly went wrong with my hospital that I went to? It comes down to four HCAP questions concerning discharge planning. The first of which is, were patients asked um, whether they had help after discharge? Only 68.2% of the patients reported yes. The second question was, do patients feel that their discharge preferences are being considered? Only 25% felt that they could strongly agree with this. The third is, did patients feel that they were provided with enough patient teaching concerning how to manage their health post-discharge? And only 37.3% could strongly agree. For the last one, where patients felt that they had a lack of knowledge and teaching regarding post-discharge medications, only 45% agreed that they were knowledgeable about their medications that they would be responsible for taking. As far as trends go, for written discharge instructions for the patient, the trend was very erratic. The scores could drop or increase by 15 percentage points each month. However, the trend slowly started to stabilize the last few months. However, they were stabilizing 8 points under the national standard. For concerning if patients would have help after discharge, the trend shows a consistency hovering around 70%. However, this is still under the national average. The last trend that I can find was, did the patients feel that their post-discharge preferences were being considered? And unfortunately, this is where a sharp decline in the last 2 years could be seen with no improvements at all in any of the months. And so this is definitely an area that the hospital should address. The root cause analysis simply falls to a fact that the hospital I went to does not have a established discharge planning tool to ensure that the planning process starts upon patient admission and that all aspects of care after hospitalization is appropriately addressed. Something that is out of the hospital's control, though, is the patient sample size that they have to work with. They are relatively small and don't have as many patients to survey, and so each patient significantly affects the scores. So if they have a negative response, it can definitely bring the hospital down. Ideally, 100% of the patients that go through hospitals should be aware of what their follow-up plan should be. They should be able to state what issues that they would have to follow up on. and they should be able to go home with discharge instructions and education. But a study I found in the Journal of Family and Community Medicine found that about 64% of the sample of patients that they interviewed um, were unaware of what their follow-up plan should be. About 59% of them stated that they would be unable to identify what issues would necessitate them to have a follow-up visit, and about 35% of the subjects went home without any discharge instructions or education at all. So the stakeholders include administration and management, case managers, physicians and nurse practitioners, staff nurses, and of course, patients and their families. The scope involves the time available to address discharge planning, the nurse's understanding of what they actually need to address in discharge planning and what the HCAP scores are looking for, and a general acceptance of the issue and a desire to improve through the use of established tools and plans. So the actual solution is a implementation of a discharge planning tool called Ideal, paired with a discharge program called Project Red. To implement the Ideal discharge planning and Project Red tools, there are some checklists that the nurses will have to implement. For Ideal, it's called the Be Prepared to Go Home checklist and booklet, and for Project Red, it's called the After Hospital Care Plan. Ideal's main points include I for including patients, D for discussing key points with the patient, E for educating them, A for assessing how well they have learned what they were taught and displaying this by using the teach back method, and finally L is for listen and honoring the patient's preferences, goals, and concerns. The components for Project Red are very similar to Ideal, except that it just individualizes the discharge planning for each patient better and concerns itself more with after the patient has already left rather than when they're being currently discharged. So some examples are for ascertaining a need for language assistance, follow-up care after discharge, deciding whether or not they need help following up results and tests and labs, organizing what kind of equipment they would need at home, providing written discharge instructions and plans about medications and their diagnosis and what issues to look for when they are at home. And also, it's similar in that they need to determine how much the patient has actually understood. So the next few slides are the discharge planning checklist that the nurses uses for Ideal. And as you can see, it lets the nurse follow a plan on providing all of the discharge information that the patient needs. This is another checklist for the nurse, which is simply a day-to-day checklist. This is the trifold pamphlet that the nurse should provide for the patient so that they know what questions to ask and what information that they should have before they are discharged. The next tool is from Project Red. It's called the After Hospital Care Plan, and it is effective because it uses large fonts, um, various colors, icons, and a simple and clear language for patients to understand. So the next few slides are for the next tool under Project Red, which is the After Hospital Care Plan. You'll be able to see all of the information that the patient will have once they are transferred home. Here you will see medications that the patient needs to take in the morning, the name, how to take it, and what it's for. It includes a list for the noon medications also, and for the nighttime medications on the next slide as well. The tool also provides nice reminders for the patient concerning what appointments they have and what their main medical problem actually is concerning their diagnosis. It goes on to individualize the patient concerning what exercises are good for them, what kind of foods they should eat, what their allergies are, and what their pharmacy is, and some of the things that they should try to avoid or quit altogether, such as smoking. So here are some of the evidence-based practice research articles I found concerning Ideal and Project Red. For Ideal, I found the pilot case study where they first used the tool at a place called Advocate Trinity Hospital. They used it on a 29-bed medical surgical floor. The issue that they had was similar to my clinical site where they had poor HCAPs and Press-Ganey scores related to discharge. The intervention was obviously the ideal tool, and the results showed improved scores and upward trends for the next 12-month period. involving the implementation of the tool. For Project Red, I found an article in the American Journal of Nursing where researchers conducted a trial that showed that RED intervention reduced hospital readmissions and saved the emergency department visits 30% and saved more than $400 per patient in terms of preventing readmissions right after being discharged. For another article about Project Red that I found in the Journal of Patient Experience, they found that a greater percentage of adult patients who received Project Red rated the quality of their discharge as very good, which is the top box score that the hospitals need in order for their HCAP surveys to meet national standards. The last article I found about Project Red was in the Boston Medical Center survey that they did. They had data from research that indicated that patients who received the Project Red intervention were significantly more likely to choose top box responses concerning discharge questions than those who did not receive the intervention. So 61% were likely to put strongly agree and respond with a yes to discharge questions, whereas people who didn't receive the intervention were more likely to put no or agree, never, or sometimes, and for the patients who did that, it was 35%. So the hospital should see improvements within the next 12 months after implementing Ideal and Project Red. They should continue to implement it until team members and nurses are able to be proficient enough to seamlessly incorporate them into their nursing practice. In order to identify if goals are being met, HCAP scores should continue to be closely assessed to see increasing trends and improving scores with patient satisfaction. And this has been my PDSA presentation. I hope you enjoyed it. Thank you very much.